There we go. Yeah, go for it.
State and county initiatives, local county programs and their local county initiatives, and then systems work and collective impact across the board. The annual report is developed using data from a variety of sources, and they include the data that the information that First Five California has collected as we are developing our strategic plan and policy agenda, First Five California investment reporting. So those are data sources that are specific to a program like Impact or the home visitation program, refugee, dual language learners, or others. It includes other state level partnerships and coordination information. It includes information that was developed through funding and to disseminate some of that research and knowledge that we have developed. It includes county highlights, so they can really describe what they're doing locally and what they think their biggest wins are. But most importantly, and most relevant to today's presentation, it consolidates all of the county annual report data that's collected, and it includes fiscal data, service data, demographic information, research and policy results, and everything, well, almost everything is organized by the defined result and service categories that is directed by the guidelines that you have before you today. So with the multiplicity of audiences and their diverse information needs, combined with the diversity of programs and approaches comprising First Five initiatives broadly, the current structure incorporates multiple approaches to presenting all of that information. Next slide, please. So the guidelines document that you have today, it provides counties with information on the categories and definitions of data required for the annual reporting process for the forthcoming fiscal year. And it's finalized in advance of the fiscal year for county preparation and planning. The data outlined in the guidelines includes revenue, expenditure, demographic evaluation, and county highlights. It clearly maps out all of the how they report all of that information. And the guidelines and the annual report process were originally developed in coordination with input from staff at the association, representatives from county commissions, and other research thought partners. The guidelines and the annual report process has evolved over time, but the version shared with you today does not reflect any significant amendments or changes from the previous fiscal year. The few changes from last year's guidelines to this new version mainly constitute minor technical updates to fields like dates, a couple of revenue categories, and then just a few minor definitional adjustments. Next slide, please. So as a bit of background here, the process to plan for and collect data at the county level, to report data to First Five California, and then to develop the annual report document itself that you all received recently, it does occur over an 18 to 24 month process. And this has been established to ensure adequate time for all the counties and all the other parties to get their data in a coordinated format. So for example, the guidelines presented to you today are for the 2023-24 data collection period, and it's represented in the middle row that you see on the screen now. And I included the current and the following fiscal year just for reference. But so you have the updated guidelines prepared for your review today, looking at that middle row there. And the guidelines should be approved and posted no later than July 1st. That's what is referenced in statute. So they will be brought back to you in June for final approval. Based on this guidance, counties will collect service and service data in the prescribed format over the course of the 2023-24 fiscal year. All of those data points will be submitted to First Five California between July 1st and October 31st. And our staff at First Five California will then develop the final annual report document and share it with the commission in the following January for your approval. Given the need to get guidelines out to counties in advance and the timeline you see above, implementing changes and updates can and do occur, but not always as rapidly as we would like. This process that we've established does allow for planned, coordinated, standardized, consistent data across all counties. During the fiscal year 2022-23, we will be looking to address some of the missing demographic data that was discussed back at our January commission meeting. Our team will be coordinating technical assistance and input sessions to better understand why these data issues are occurring and support improved data reporting in those language and race ethnicity fields. We will also be working with the association and counties for feedback on a set of dashboards covering a variety of items within the annual report. Looking forward to implementing more robust changes for the fiscal year 2024-25 year, the Program and Evaluation Advisory Committee did meet 2 weeks ago, as Commissioner Major shared earlier. And at that meeting, they approved a plan to work together with First Five Association leadership, county commission representatives, and other stakeholders to address some larger refinements that we know are needed related to annual reporting. And so we will be convening an annual report work group. Next slide, please. So a bit about this work group. It will collectively address the tasks you see here. We plan to reevaluate the annual report on a broad scale, revisit the goals, audiences, format, data sources, and products, and reimagine what it could look like or what it should look like. We will develop a set of recommendations for your review and approval. And lastly, the work group would set a plan for implementation. And that includes updated reporting guidelines and ensuring everything is clearly communicated and operations are set. As an essential part of the success of this work group, we want to include all the voices that are needed. And to that end, and consistent with previous annual report development committees, it will include First Five California staff, but we will also extend invitations to our partners at the association and to the counties. And we would also, again, like to consider other experts and stakeholders who may inform what information is needed about the populations we serve and how to make that report the best it can be. Next slide, please. So that concludes my presentation. We will be bringing this back to you in June for final approval. So this is just an opportunity to address any questions you may have and address any public comment.
Thank you, Gretchen. Appreciate all the work you're doing. I know this, like you said, 18 to 24 months to get this moving is quite a feat. Thank you for your patience and your service. Any discussion from commissioners? Public comment? Avo?
Excuse me. Hi again, commissioners. I just went down the wrong throat right now. Sorry about that. Thank you, Gretchen, for the presentation and for the presentation at the Program and Evaluation Committee. We understand that this year's changes are minor, and so we're happy to engage counties and support First 5 California with any feedback on those minor changes and send them up to you as appropriate. And then we also just want to commend the team for looking at a comprehensive relook at the annual report. We understand that it's time. And at the same time, when we look at the annual report, we also want to ensure that looking at the components of the annual report, also look for ways to reduce the administrative burdens on our counties, especially with declining revenue and with many of our counties being small population counties as it is. I also just want to lift up a comment made by Commissioner Albright a little while ago around looking at equitable evaluation frameworks for future annual report sections, and also thinking as early as possible around examples that lift up systems change work that aren't always individual level data, but are much more population or systems level data. And so I just want to plug those seeds in to all of you as we continue to have these conversations. But overall, just really appreciative of the inclusiveness, and we look forward to participating in the work group in the fall. Thank you.
Thank you, Alvo. And it sounds like you may do some homework on some of the examples that you lifted up as well, so that Gretchen doesn't have to look for them on her own. Any other public comment?
There's no more public comment. Oh, she's on mute now.
I can hear you. Thank you, Gretchen.
Thank you.
Okay, we are now going to move to a 25-year look back, and Dr. Williams will be leading that discussion. Thank you.
Excellent. Thank you, Chair Perez. Members, the headline here is you asked us, in particular, Chair Perez, to look at what is First 5's effect at the end of the day. And a lot of what this brief presentation is simply going to provide is a way to do that. So next slide, please. So as you know, the Act has not been comprehensively evaluated since its establishment in 1998. There are assessments, obviously, of investments, but a comprehensive sense of what is the effect of First 5 as investments over time since the statute has been established has not been done. This is that request. So the evaluation that you have asked us to set in motion would consider the effects of past and present investments. It would compile and synthesize past evaluations. It would identify areas for future investment. It would help solidify the selection of indicators of readiness for ongoing monitoring. Your input on this is extremely important. So particularly once I stop talking, we'd love to engage you in conversations related to, or a conversation related to what you would like to see in this 25-year look back. Next slide, please. So there are lots of questions that could be asked, and these are examples of those questions. At the macro level, how has the Act moved the needle for young children and families in California? And how do we continue to push that needle? More specifically, other potential questions include, how has the Act changed the landscape of early childhood policy in California? What impact has the Act had on changing systems that serve young children and families? Who has received how many and of what kind of services via the Act? Who has been reached by media campaigns and to what effect? What success has resulted from the act and how did that come about? Where has the act yet to succeed and why? What investments should be considered next? And how should First Five California monitor and evaluate impact moving forward? One thing to think about before I go to the next slide is if you look at the cascade of history related to the First Five Acts, you look at 1998, Prop 10, it's preceded by 1988, Prop 98, and of course, 1978, Prop 13. And I would say the epicenter is 1971, Serrano versus Priest. In those time periods, voters in California have said the same thing. They've doubled and tripled down on their investments in education. And so having that kind of foundational ground for what First Five has done and will do is important, not only for ourselves, but also for external audiences. The methods that will be used in this type of study, depending again on the research questions selected, would be document review, quantitative assessments, and qualitative assessments. So numbers, stories, and document review, historiography to a certain extent. Next slide, please. The deliverables related to this would be historical analysis, synthesis of past evaluations, policy and program analysis reports, recommendations for ongoing monitoring, scholarly reports intended for publication, reports, infographics, and other documents for public dissemination. Next slide. So, want to engage you in this conversation, and I'll also invite Jackie to jump in with other details related to who, in terms of the selection. We're obviously looking at reputable research organizations. Many universities and others would be apt partners for us to work with on this, but just interested in your feedback on this notion. And again, just want to put a kind of a bold underline on this. You asked us to take a look at this and to set the wheels in motion, and we've done it. This is the suggestion, so we just want to get your feedback as we move forward.
Thank you, Dr. Williams. Just a point of clarification in terms of the proposed timeline. I saw the 2 million, but depending on what the discussion is here, what was your hope in terms of having an actual vote on this?
That's really a good question. It's really going to depend on who does the study and how deep of a dive we take. Many of these studies have really flexible timelines. It won't be 2 years, but we should expect some length in terms of the study. So let me give you one example. We could just do a study related on document, right, review. Our best bet is to triangulate the data, to have documents and then quantitative data on numbers, and then interviews, maybe an ethnography, right, a deeper dive to get the real flavor of what has been happening. That will take some time. I don't want to give an estimate just because I don't want to I don't want to, jump over the research entity that would do that. They would give us a proposal around that. But definitely, I believe time is of the essence. So getting it more sooner than later, I think, will be appropriate.
Can I provide the state agency response, Chairperson? I think the intention is if all these questions look good. I know that in a previous iteration we had presented this to then Commissioner Alvarez and Commissioner Mijic on this proposal. We would like to possibly as soon as June to get authorization if these questions and directionality look right. After that, if there is approval in June, or you can say, no, these questions aren't right, it's not the right direction, come back. I think the benefit of actually having every other meeting, there is less of pressure, if you will, but we're seeking, we know that this is a priority, and in part because of the sustainability conversations that we've been hearing about all day long for us as well as our partners on the ground of really we're seeking feedback and directionality here. And we can, because the idea is to work with a public university partner for this project, it's fairly, in state government terms, quick to do that more so than other situations.
Thank you for the additional context. I guess I'm grappling with, and you sort of named it, Jackie, is that there's this push to let's get in there and say what First Five has done, but there's also this, going slow to make sure we're doing it right, or as right as we think. And to me, that also includes now more and more hearing what stakeholders have to say before we come out with something, like saying what would be most helpful, like not just having us decide here are the questions that we want answered. And so for me, I think that's part of like another pre-step is getting feedback from the association, potentially other stakeholders, like what is most helpful in order to really tell the story, like as in all data, conversations get real clear on what are your questions, what are the 3 things or whatever we want to answer. And I feel more comfortable hearing what others, particularly local commissions, as well as the association also think is important, especially because of the sustainability issues too. So that was one of my just initial reactions of, is there an ability to maybe take a little bit of time and hear and get input before we jump and say, okay, here's the direction.
Yeah, we can take all the time in the world. That's why it's the information item, Chair Perez. And part of the process, if there's direction to do so, is that we can take it back to the new formalized program and evaluation committee for a fuller discussion on the levels of details. We need to hear this. Like it's not, it's literally just a conversation about, is this the right direction? Is this still of interest to you? It's $2 million, et cetera. I see Dr. Williams' hands up as well as Commissioner Jimenez, so I will yield the floor to you, Chair Perez, on who to speak next.
I didn't see whose hand was up first, so.
If I may, I put my
Yes,
hand
please.
up first, but I like to
Yes.
hear from Dr. Williams before I make my comments.
I would only add to the timing. This is more of a political consideration. Within the next 2 years, the legislature is going to be grappling with, as they are now, right, a 25 billion shortfall. And notions of our effectiveness will absolutely enter the conversation. So I think, not to rush it, I agree with your sensibility, right, to make sure that we have input from stakeholders. And I believe we have a great relationship with the association in Alvo to be able to pose the questions and get that. But we also want to make sure that we're getting, last point, the recommendations from the public research universities on the particular kind of study to increase the validity and reliability, and also the generalizability of the findings. Because at the end of the day, this is essential to do, and your direction on actually getting it done, proposing it, is extremely important really to the next 2 years in terms of what the legislature will do and won't do.
It's a fair point, and I'll just say to that, there could be iterations, right? There could be one piece that comes out sooner. There could be different ways to look at it. I do want to flag, though, when you say public university, I do have some pause, because working in previous government spaces in the state of California, people automatically said that's an extra 20 to 30 to even higher increase in the amount of money that's going to be charged. So just for what it's worth, given our constraints, just to be mindful if perhaps there's a way to think about others, not dismissing that, but just raising that as a potential question. Commissioner Jimenez.
Thank you. I'm wondering if, for the purpose of just not further delaying this, coming back with a more polished proposal from staff, if right now we have thoughts on the questions that are being proposed and what are those changes, and then staff can continue to have those discussions with Ivo, who then hopefully will have those discussions with his members before meeting with Dr. Williams, so that we can assure that their voice is included in what's going to be asked, and also do our due diligence with respect to what kind of study we would be doing. And that, I think, could be accomplished before our next June meeting, when staff can return with a more polished proposal for evaluating, looking at a 25-year look back that has input from the stakeholders we've discussed. I guess for me, and I don't have a specific question, but and we're looking at our first 5 resources. So how are we going to incorporate the value added by our local first fives, right? So we receive the funding, we give it to them. Obviously, we spend funding in certain lanes across the state. We make RFPs available. But will this study also look at, okay, what about that 80%, right? If I remember correctly, 80% of the dollars go down to locals. That's a bigger chunk of money per se. And so how are we going to evaluate, you know, did they make an impact? And I guess, so that's kind of my first question, how we're going to evaluate and assess that. And then for me, really what's more important is what do we need to be doing differently going forward? We can applaud ourselves on the things that we've done well to advance this. But I think we've shifted in terms of, you know, really looking at systems, and our systems really ready to be able to better support our families and our children. Is there a different way to be thinking about what are the investments that we at the state level should be making, as well as encouraging our locals in terms of how they invest their local money, again, to really transform systems and help us move further along the spectrum, moving more upstream. And so I don't know how we capture the local impact. And then again, just my plug for from this point forward, what do we need to be doing differently?
I think just to take that question on, metrics can span from participation metrics, right? Counting numbers, how many people served, to effectiveness metrics, right? In terms of the money was granted for this, and then what were the outcomes related to that? And that's the biggest, you know, extent, and all of the pieces in between. And I think that's really essential, because we do have our own documents related to, and the association does as well, evaluation. The annual report gives us a tremendous amount of metrics and numbers related to that. So there are a couple ways to think about it. I don't want to, well, let me say this. So that's the real kind of extent or length. Also, I just got a quick note from Amanda, who works in research and evaluation. I'd love her to jump in and take a part of this question as well. Can we add her as a panelist? While we're adding her as a panelist, one thing to add. So we're also after a particular amount of unvarnished truth. And what I mean by that is any study challenges us on the money that we spend and its effectiveness, and at the end of the day, sets a course for the future. A lot of what we can do is really only based upon a clear assessment of what we've done. We'll also find, and I appreciate your comments around these larger shifts, right? The systems-oriented shift. Now, within probably the last 5, maybe 10 years, but I'd say 5 years, the focus on systems is more deliberate. One last point before we go to Amanda. There is a broad sense of the bigger question, has First Five been affected, right? State agency, locals, all of the rest. What we know, what we are pretty clear on, what we have a hunch about is that yes, right? TK probably wouldn't, the expansion of TK probably wouldn't have been passed without a ground seeded by First Five for the last 25 years. So we know that, we have a hunch about that, but we want to turn that over to the data, right? To either, right, tell us, no, we had not, or yes, we did. But I think that's pretty clear. I think we can see that from the 30,000 foot level. We really want to know, how was that done? Because then it says, what do we do the next 20 years? If we know that for sure, and we find that out and we verify that and validate that with a research study, it actually sets us up for success. Amanda, jump in.
Hi, good afternoon. Thank you so much, commissioners, for listening to this presentation, and to Dr. Williams for presenting the presentation. I'm sorry for being off camera, and the reason that I'm both off camera and was unable to present today is that I'm suffering from a back injury and I'm not able to sit up straight. And I have a surgery next week coming up. So thank you so much for letting me pop in and provide some answers. I just wanted to speak to a couple of the questions, and if there's any more, I'm also happy to talk about anything else that I can pop in with. So first, one thing I want to say is I absolutely hear the comment about input from stakeholders, and I would just want to say that any evaluation partner that we would hire, any good evaluation partner, would make that a #1 priority beginning their contract would be, yes, meeting with the association, with counties, with parents across the state, with other stakeholder groups, with you all, even if you're available and willing, before, really narrowing down what those questions that they are going to ask, the methods that they're going to pursue, basically their process. Again, any good research group, that should be one of the very first things that they do, because we're not here to say these are the questions, now we're going to go out and find the answers. We're here to partner with communities, to partner with families, to partner with childcare professionals, to partner with you all in the association, to really find out what's important here, what's going to advance our knowledge, what's going to advance the state of early childhood and early childhood education and care in California. So I really wanted to make sure that we understand that will definitely be part of this contract from the beginning. And I wouldn't want folks to, decline or push back too long, if they weren't sure about that. So it absolutely is in there, will be from the get-go. And I anticipate that whatever partner we select will be coming back to the commission, telling you about their progress, telling you how they advise that we narrow the questions, how they advise that we move forward with the methods and the process to get your feedback and report on the feedback they've been getting from other parties. So that was one comment I wanted to make. And now I've forgotten the other question that was also very important. Shoot, I'm sorry, maybe it'll come back to me. But hopefully that was helpful. Give me a moment. Blame the painkillers.
Thank you, Amanda. No worries whatsoever. I just want to thank you for being here, given
I remember.
The situation you're at. You remember you just said?
I did. I just remembered.
Okay.
A question was about how are we going to be considering the impact of the other 80% of the funds? Absolutely. So again, a good research partner will be able to think through ways that we're not just evaluating our 20%, but that 80% as well. So an example might be that they would look at either publicly available outcome or indicator data in the different counties, or perhaps linked data sets that we are able to get access to or that they already have access to. Some of the potential, some of the potential partners around the state do have a lot of access to administrative data or other kinds of state data that they could connect it to. And thinking through, looking at what data we have available. So for example, in those annual reports, counties are telling us how much money they're spending on different things or how many folks they're serving in different ways, that our research partners could then come up with some ideas about how we can evaluate whether these, the way that counties are spending their money or the way that they're serving different folks may relate differentially. And of course, considering all of the variety of factors of how diverse our counties really are and their populations really are, and taking that into account, but seeing if we can link any of those services or different funding mechanisms or funding levels to different outcomes across different counties, or even across, if we wanted to compare to some different states. Those are just some of the way, that's one example of how a good research partner would be able to look at that 80%. But again, absolutely, that is part of this. We want to get some really experienced, really knowledgeable expert folks in here, again, with input from folks on the ground at every level, to really look not just at what has the state done, but really the impact of the act overall. And I think it's, we have some really promising ideas, and your input is very valuable. And thank you for lifting up these concepts that are so important.
Thank you again, Amanda. you helped clarify, so it will be the whole act, so the
Yes.
80% and the 20%. And for me, that's even more reason. You mentioned that it'll be best practice that the researcher go engage with all stakeholders, including the association. And I think that's a little too late to engage with the association. I think they should, but I think if we're going to look at the 80% that goes to the locals, I would hope that we'd want to get input before June on what the locals think about that, help us think about the question. So I think Commissioner Jimenez has said that too, that there could be a chance to do that before June. I don't want to put the pressure. I hope that that works out, but I think it would be a missed opportunity to not have local input before, especially now that you've clarified, we will be looking at the whole act and they are the lion's share of the act.
Well,
I'm
just let me
wondering-
comment, hold on a second, Amanda, let me comment on that. So, we have time between now and June to talk to the association. Again, we have been having great conversations with them. I'm 100% sure that even in this presentation, they're taking notes that'll be shared with us. Amanda and I will take that on personally, right? It'll be the first thing we do on Friday is to say to Abo and team, let's talk. And we'll send them the slides and we'll make sure that they get all of the access that they need and desire as it relates to the questions. We can do this.
Great. That's great to hear. I think that's just a good practice for us, especially that you're saying you're going to look at the whole act. And if you have, you said knowledgeable experts, they themselves have had to do different types of reports. So maybe they also have ideas on the who, which expert you're looking at. And then my final point is I know some of the locals may even have interest. I shouldn't assume this. There may be locals who can help augment, or I don't know if that's the right word because I'm sensitive, but if they have already connections with researchers, I just don't know. I would want to do a full assessment of what are locals' connections already with research before we're saying, oh yeah, let's spend another 2 million. I just want to do that check-in as well with them.
Well, we just want to make sure that we also want to be very sensitive around the fidelity of the study, right? We definitely want everyone's input as it relates to research that they've worked with. But we want to be able to have a particular kind of rubric so that the study is generalizable, it's valid, it's an entity that's done something like this before, right? It's better to have an entity that actually focuses or has focused on, right? This might be one of our requirements that is focused on the assessment of state agencies and local entities at the same time. This is a particular kind of report, right? This is a very specific kind of research study. And I think that the association will have suggestions and I think those will be great. And we'll also try to look for an entity that has done something like this before.
So just to clarify, association and the locals, and then you raise a good point. So Mental Health Services Act has a lot of requirements that they be evaluated. They're a public independent state agency as well as in the local counties. So I think that is an interesting way to see who's evaluating them. I also think someone who has some expertise in the social sciences or even early childhood, family policy, social policy, because that qualitative, it's going to be a lot of qualitative, I would assume, and I really hope quantitative, but I hope that, you have a good list of folks. I know in the past, it's been a little hard to get our bench, to get our binder full of what are potential researchers, facilitators, et cetera. And I just hope that, we can get a good list of options for us. Thank you.
Absolutely. We're happy to take that direction.
And
Absolutely.
I would also venture if there are commissioners who have researchers that we want to consider, that's something that I believe staff can take note of as well.
You had also asked specifically about the questions. I know Commissioner Jimenez had raised that as well. Are there any?
Can staff bring back up the slide of questions? And this is just, again, these are potential questions. And I think that that's right, Commissioner Jimenez. These are the questions that are a consideration that we will bring back to what Dr. Williams said to the association and other impacted stakeholders. But this is kind of, again, these could be it, could not be it. These are big picture, high level.
Let me ask you a question just to guide you even in these questions. What I really want to know is, what do you want to know? And if we can start there with like your basic, like, I want to know this, I've always wondered this. That could really help to guide us. These questions are really, again, you've seen these, you could dream these up. What I'm really interested in is, what do you want to know?
I think the question I've had is just the impact, not just the
Mhm.
impact. What has been the impact on first five investments? And I know that might make some people cringe, but the way we define it's important. But I do want to look at the impact that we've had.
Let me ask you a question about that. Sorry, I'll be brief. So when you say impact, do you also mean, because I know you mean on policy on children and families, but do you also mean on the local economy?
Sure. I think that's where the benefit of a researcher, right, can say, here's what we can look at, here's where we
Right.
can, tease it in even more.
Because I think that's an amazing effect that doesn't get counted much, is that there are lots of people employed by First Five that in fact make up that community that they're serving. And so they, like most state entities or quasi-state entities, serve as an employer. They create careers. That's another way to think about it.
Yeah. No, I think that is definitely something to consider. Let's see, Commissioner Hazen.
Thank you. Yes, so I think, and Dr. Williams touched on this a little earlier. For me, the why, so it's not what the impact has been, but really having a better sense of why. What are those things that are replicable, that should be built in how we do what we do, that we should, be aware of. So for me, I'm really interested in understanding that.
Thank you for that. We're taking notes.
What struck me as well is that yesterday's conversation, hearing from a local grantee talk about, and San Diego, Alethea talking about how, yes, it's wonderful that the states brought in these additional dollars. Like we just talked earlier today, $4.7 billion. And yet there's still this gap that only First Five can step in and take at this point. So I think recognizing, like you talk about the landscape shift, like early childhood is now a central policy issue in our state. And yet there's still these gaps that First Five has only been able, local First Fives have been able to step in and fund marginalized populations, for example, that can't be funded with some state or federal dollars.
Excellent, thank you.
And I've got one more thing that I meant to say before, which is a curiosity I have is also around, right, as we look at declining revenues, like, was there a point in time, is there sort of a minimum funding amount required to drive whatever sort of like that greatest impact we've had? Like, so was there a point in time when our impact was great and that was tied to having more dollars available? And or have we gotten good at sort of leveraging and thinking, about how we can sort of leverage limited dollars? I don't know, but I'm interested in that also, right? So the dollars have gone down. Has our impact gone down as a result or not?
Thank you.
This is your discussion, but reflecting back on Commissioner Albright's conversation, is that are these data, you have an interest on impacted communities specifically to, okay, I'm seeing a nod, I'm not sure, I noticed that wasn't in here, but just disaggregated data that would say we're effective in these communities, not in those communities, and different kind of demographic data. Okay.
Thank you.
The disaggregation, Jackie, that you just said was interesting too, like within each program. So we know, like in the mental health space, that there's even additional barriers or additional needs to certain populations. So how granular can they get, or can they pick the biggest buckets that we've invested in at least, and really dig into those further versus just let's look at everything across the board. There might not be enough data. There might not be enough, there if we did 5 million versus the 200+ million that has gone into impact, for example. I'd love to hear, and this is not just a look back, so maybe it's out of scope, but just in terms of the sustainability issue, maybe that's where Shana was going as well, is like moving forward. I think Commissioner Jimenez talked about that too, just moving forward about sustainability, like right here, always on our face. What does that mean? How do we be smarter? I've heard Marco and others talk about getting really creative in how we get funded. Like, is there a way to look at that, or is that just completely going in a different direction, or is that could be another part of this discussion, given that that's a very real current challenge?
Got it. Thank you.
Commissioner Majors?
Mute.
Oh, can't hear.
You'd think after 4 years on Zoom, I'd figure that one out. I just want to add, I don't want to repeat anything anybody's saying, but two things. One, just keeping the end in mind, like what are the things we really want to be able to use this data for? I mean, a 25-year look back, I think is great, right? But you want to make sure, because it sounds like we have these competing priorities, like we want it fast, but we want it done thorough and slow, right? So I would say wherever we can sort of streamline the data, I mean, because all data is good, but it's not all useful. And so I think really thinking about keeping the end in mind, I just suggest to you all as you're going through this process, because I think everybody has so much to give this and so much information to give. I will just say all this, and this is just a little bit nostalgic. I was in ECE before this started, and I will say I can just, the first 5 and this whole sort of campaign has really been the glue that binds in so many ways, because I had only been in the field for about, let's say, 6 years. I'm giving my age, but there was really nothing that connected us. And I was on the master planning committee and all of that. I was very young at the time, I'll say, but there were some things, but they were very centralized and they were not coordinated. And I will just say my little looking back has been very positive. And I think it'll be nice to see the direct impacts of our work and our dollars. But I also think there's this anecdotal impact that it's had on those of us in the field and these children that are now 25 years old or 30 years old. So I'd love that to come out of it in some way.
Thank you.
Thank you, Commissioner Majors. Are you open to being interviewed?
Yeah.
Sounds like that would be great. Any other comments from the commission? Seeing none, public comment?
There's no public comment.
Okay, thank you again, Dr. Williams.
Thank you. And thank Dr. Lawrence.
Thank
Speedy
you,
recovery
Dr.
to you.
Lawrence. Yes, speedy recovery. Thank you for taking the time. We really appreciate it.
Thank you all.
Okay, I'll turn it now to Jackie to talk about the data landscape.
So thank you. I would love to, whenever Dr. Putnam-Hornstein and Dr. Faust here, I think that they're in the waiting room right now. They will be my co-presenters on this. So just as a reminder, just a look back, and for those of you who weren't here, this is part of the Cal HHS proposal. There was a slide deck in my ED report about partnering with Cal HHS. And this is part of building upon the Strong Start Index that we know that the First Five Association, as well as the First Five Policy Center, were the original investors. And how do we actually work with the Strong Start Index to begin to, I think that this is raised already. What are the population level indicators that would also help track our success over time? So Jamie, oh, hi, Dr. Putnam-Hornstein. Did I make it up that Dr. Faust was also going to be with us?
She is definitely going to be with us. Let me text here. Hopefully she will be here in just a second. I know she's been on.
Yeah.
She asked if you could let her in. She's still waiting to get in.
Okay. So as we wait, Dr. Putnam-Hornstein had presented to a few of us during the summer when we were at Crystal Stairs and had an introduction of the Strong Start Index, and just really just have such a tremendous amount of respect for her. And I think, I'm not sure if I said this before during the summer, but she and Dr. Faust and the Strong Start Index is the only index of its kind. I want to say internationally, probably, that because they have worked for decades to get interagency agreements for everybody's data, EDD, CDE, CDSS, all of that. So really grateful to have them present to you today. So staff, I think is it time to pull up the deck? Yeah. Oh.
Perfect. Well, I just want to kick it off by thanking everyone for the opportunity to share this today. We consider ourselves longtime members of the First Five family. We were launched by First Five LA over a decade ago, and the Children's Data Network has had sustained funding from them. We've partnered with First Five San Francisco, First Five Orange, the First Five Association, the First Five Center. And I also want to acknowledge all of the First Five California staff who were really helpful in serving as a sounding board and providing feedback as we tried to think about some ways that we could leverage the Strong Start Index to make sure that the First Fives had the data they need to be really strategic moving forward. And I know that we were just talking about that 25-year look back, which is so important. And I want to kind of pick up on something that Avo had said earlier on, that the First Fives really put early childhood on the map, which I think is exactly right. And so what we're going to be sharing with you today are some ideas that we have for ways that we can use data to kind of augment, connect, support, and collect new information to ensure that California continues to make really smart strategic investments in children 0 to 5 at the levels that are required to ensure that every kid has a strong start and that we're really moving forward in achieving greater equity for all of our children. So Reagan and I are going to kind of tag team on this a bit, and then we would welcome questions. And so I will now turn it over to Reagan. Thank you.
Hi, everyone. I actually just wanted to start from the beginning. So let's start with birth. Every year, there are more than 400,000 babies born in California, and each birth generates a record. Emily, can you hear me?
I can hear you, but we're not seeing your slides move.
All right. What about now?
And this is a very adorable child, but I know you have some other great slides to show us. So
yeah. We have many, many adorable children.
There we go. We got it.
Excellent. Okay, so each birth generates a record, and flag me if it's not progressing. We have, so on those birth records, a decent amount of information, maybe, no. Interesting. All right.
Dr. Faust, would it be easier for our staff to advance for you? I don't know if it's a bandwidth issue or...
You know, it's actually a technology mojo issue. This tends to happen when I'm running slides. So I actually, you know, I'm thinking that it would be maybe Emily, you might want to progress them just to make sure that all the animations are working.
Perfect. Sorry, Reagan, I'm just pulling them up.
Yeah. And apologies, everyone. This is a common theme in technology moderated presentations with me. My brother likes to call me the walking EMP, and he is the opposite of that as a technology, and security IT specialist. How are we doing on that? Sorry to put you on the spot.
All good. Oh, Reagan, I just realized we're not going to be able to get the animation with this though. That's okay. That's all right. We will make do. I think Reagan, you were on this slide.
Yeah, perfect. So on those birth records, a decent amount of information is collected, and you have information related to maternal and infant health. You have birth weight, gestational age, health conditions or birth complications of labor and delivery that all could have implications for future outcomes. You have sociodemographic information, including parental age, race, ethnicity, educational attainment, employment status, maybe need for nutritional assistance. Geographic information like the hospital of birth or the baby's first address. Importantly, it's not just information for the infant, it's for the family as a unit. And essentially, birth records form a snapshot of the constellation of resources available to individual children. And when combined, they form a rich data set that could be used for prospective and local analyses for entire populations. We can go to the next. When mapped, you could start to see the variation that exists in those resources across communities and sociodemographic groups. So many of you have seen this before. These are just a few screenshots of the Strong Start Index that uses information available on birth records to visualize the distribution of resources among babies born in California communities, to highlight where the disparities exist, and also to facilitate more equitable investment for children and families in California. And in fact, one of the main drivers for this index was to deliver information about births more quickly to First Five commissions to facilitate community needs assessments and other budgeting related concerns. And I should note that we will be publishing information about the 2021 births in the end of June. So that's coming up. Go to the next slide. Another way that birth records have been used is to inform programs and policies is through this cross-sector data linkage. So for 5 years running, birth records have been integrated with other client-level records across major Cal HHS public benefit programs, including Medi-Cal, WIC, CalFresh, CalWorks, Child Protection, Developmental Services, and others to generate important information about service involvement at a client and population level. And you can see here a few visualizations of this cross-sector record reconciliation from the Cal HHS Open Data Portal. Now, if we move to the next slide, I'm excited to share that a number of other initiatives are including California Brilliant Beginnings, the Whole Child Equity Tool, Cradle to Career Data System, and others are coming online. And this is great. There is enormous potential for these efforts to enhance this whole child perspective by integrating ECE, education, and other records for children as they age. And once these projects are fully operational, it's possible that we could start from birth to characterize that cradle with an eye toward equity. And each new data related and technology development moves us closer to a more robust child-centric understanding of early childhood in California. So if we move to the next slide, this is awesome, right? So why are we here? From our perspective, there's more work that needs to be done. So a little bit about the Children's Data Network. We're a data and research collaborative focused on the linkage and analysis of administrative records. Much of our work is prospective, so we start from birth. We use integrated data to follow children forward to characterize their experiences, public service interactions, and outcomes. We also act as an extension of state and local government, helping to envision, build, and sustain the systems that make the underlying linked data available for research and analysis. And ultimately, our goal is to harness the scientific potential of linked data to inform children's programs and policies. And the work highlighted in the previous slides gives you a taste of our many projects. And we work really at the nexus of the academic and public sectors and have a reputation as trusted partners in this space. And because of it, we have a unique vantage point from which to view existing and emerging analytic, operational, and policy opportunities related to young children and their families. So from where we stand, we could go to the next slide. We see the great data work happening in this space. Much can be said about the health, safety, and public service interactions of young children involved with public benefit and service systems in California. But more can be done to augment what's there, to better characterize the experiences of and really lift up young children specifically. Second, currently, less can be said about their experiences and engagement in ECE and other family support services. But connecting the dots on the developing landscape of data related to children ages 0 to 5 and supporting those ongoing efforts through targeted technical assistance would be instrumental to identifying prospects and facilitating future integration with existing child level data, and incredibly timely given their stage in development. So third, the existing administrative data tell us that despite all of the resources available in California, a substantial proportion of young kids are at risk of poor outcomes. And we also find that at times, and owing to our population-based frame, we find that the very programs designed to help and support young children and their families are not reaching them, those who need them most. And finally, we've come to appreciate that administrative records and data will always be limited in its ability to give us information from the perspective of the children and families served. It can't tell us what services were offered to new parents, maybe the barriers, benefits, challenges, and who were missing and why. So if I want to dive more deeply into that last point. So don't get me wrong, I love administrative data. But when we're looking at the data, we often forget that we're not seeing the whole picture. And what we don't see is often more important in terms of policy and program development than what we do. For example, here is a graph of service engagement. Now, this is for illustrative purposes. So we see the proportion of families in each home visiting, early care and education, and other community-based supports. So as an example, previously in the animated slide, you would see that those three components actually comprise the entirety of the graph. Whereas now, what we're saying is actually what we should be focused on and see is the entire graph that includes families who are not engaged in service. So that's the whole picture. And our lack of understanding about the needs and experiences of families who are at high risk of poor outcomes, but are not engaged in services. It hobbles efforts to align needs and supports, evaluate and improve programs, and refine engagement strategies. And it also constrains our ability to know how young children in California are actually faring. So effectively, the administrative data in its current form and its future form will always be incomplete and limits our ability to gauge impact, address inequities for years to come. We need a new approach. So now I'm going to turn it over to Ellen to discuss our proposal in detail.
Perfect. Thanks, Reagan. And so what we have proposed for the next 3 years is a set of, I guess we're calling them streams of work, in which we would attempt to augment, connect, support, and collect population-based information that will directly inform investments and understanding of our 0 to 5 population. So under the first stream, augment, what we are proposing to do is to further expand the Strong Start Index. I think many of you saw kind of a bit of a demo of the website. What we'd be proposing to do is update it with additional birth years, but also based on feedback that we've received from county commissions and other stakeholders, we'd try to find other ways to present really, really granular geographic data that can guide local investments. So for example, one suggestion was it would be really terrific if we could have data disaggregated by birthing hospitals across the state. I think there was also a suggestion to be able to kind of overlay some other poverty indicators with this 0 to 5 data. So our first area would be really taking the Strong Start Index and figuring out ways to augment it so that it would be of maximum value as First 5 California and other First 5 partners move forward. The second piece of our proposed work we're describing as connections. I have to tell you, and I mean this in the best possible way, there are so many new data initiatives in California right now, Cradle to Career, Brilliant Beginning, the Whole Child Equity Tool, that it can be difficult to completely understand where one piece fits in with the others. And we really want to make sure that with all of those fabulous efforts, we're not losing the potential to bring data about 0 to 5 populations into the mix. So the connection piece would be a kind of an effort on our part to meet with stakeholders, pull together information about all the data that exists statewide, locally, at the state level that could inform 0 to 5, so that the commission feels very well versed in exactly what data exists for children and whether or not it's currently planned for integration into some of these other state efforts, so that there can be really strategic and informed conversations, and so that there are not duplicate efforts or efforts where we just completely miss that none of these efforts capture a particular set of records. So that would be kind of the connect piece. The third piece we're describing as support. So as Reagan mentioned, we've been very fortunate to partner closely with CHHS over the last several years to link up all sorts of data, everything from developmental services to Medicaid to birth, death, child welfare. And so what we are proposing is to continue that work, but developing some very child-focused products out of those data integration efforts that could be made available to stakeholders. So we have kind of a scope of work where we would continue to link, but make sure that we're really surfacing and making visible that 0 to 5 population. And the fourth piece of work is completely new. And it's interesting, Commissioner Hazen, you had mentioned, I think this morning, engaging families who can tell their own stories in advocacy efforts. And Reagan had mentioned data are great, but the data only goes so far. And often, when you think about that pie chart, we really don't know what are the barriers. Are there inequities in certain areas where we have kind of a service desert? What is going on? And so what we're proposing to do, and it's a fairly ambitious effort, but I think with First 5 California and Commission support, I think we can pull it off. We're proposing to use the Strong Start Index to develop a very targeted sample of families and to obtain permission to use the vital birth records to do direct data collection from families in the year plus after birth. Now, there have been efforts like this before where they're population-based, and generally the questions are about child development. This would be very, very focused on what I also heard come through in several conversations, which is a move towards system work. And so what we would be looking to do is engage directly with families. We would identify a sample. We would do all sorts of different kind of approaches. It would include focus groups. It would include text messaging. And we'd really be looking to kind of give voice and to answer some very specific questions that we believe will help inform how we structure and situate so many of these programs that, as Reagan mentioned, we are intending to reach the families who need them most, but we don't always do great with the engagement piece. So in the slides that we will share, you will see there is a detailed appendix We have lots of information where we're kind of trying to think about what can we achieve when. But I want to give space for questions. And so I'm just going to let Reagan kind of close it, and then we will stop sharing, and I'm happy to discuss these ideas further.
Thank you very much. So in sum, we really do believe that this plan is innovative, equity focused, and will be essential to ensuring that all young children in California are born with a strong start. And it will be a big lift, but we also believe that you will be the perfect partners. So why you? It's aligned with your mission, vision, and values, and will help pave the way toward achieving your audacious goal. And your visionary leadership, expansive network, keen insight regarding all things 0 to 5 will be crucial in order to ensuring its success. And why us? So our commitment to generating research about young children, our experience building the data systems in which many of these child-focused data projects will be hosted, and also our role as key advisors and trusted analysts uniquely position us to hit the ground running. And why now? We're in a critical period. So building mechanism to capture authentic family voice in the development and services and support can't come soon enough, in our opinion. And the exciting child-focused data systems that are under development are also in a critical period. Being able to connect the dots from a data perspective will now position them well to the benefit of all. And finally, we should never forget that the children and families we're aiming to support are also in a critical period in development, right? 0 to 5. So we should act with haste to support them and those who were born in the years to come. So it's our sincere hope that we're able to work in partnership and, to quote Commissioner Perez, double down on early childhood.
Thank you to you both. Just really great work. I think I wasn't necessarily clear. This is an information item, so I would love your feedback. But as you can see, we've done a lot of homework. Thank you to both Emily and Reagan. They have reached out to our partners at the First 5 World. They were born out of that work. And this request proposal right now is $3 million over the 3-year proposal. So turn it back to the commission for discussion, questions, feedback.
Thank you very much. I think I need a little bit more context and background, and maybe you could point me to it. You alluded there, data is blowing up everywhere. People want to have the data. You acknowledged it, and you work with CalHHS already. I just need to get better clarity. You want to be the connectors, but I've also heard there's those connecting conversations already happening. So that's where it would be helpful to get more context. And we don't have to go into it too much, but I did want to raise that. I'm not clear, especially now given the whole child equity tool, the Healthy Places Index. There's so much data out there telling us about what the needs are. Some of them are 0 to 5, some of them are not. I totally get that, but for me, I just like to know better what's already out there, and then the visual of how you will step in and potentially help tease it out even more.
Yeah, so we will happily elaborate on that. I think one thing, Chair Perez, to kind of the way that we're thinking about it is that a lot of these efforts are still highly aspirational. And so if you take, for example, Cradle to Career, it's an incredible effort, but we don't yet have any data. And I think a lot of the early efforts are going to be focused on older age groups as opposed to 0 to 5. And so I think that the opportunity we have here in the short term, this would not make sense for the commission as a 20-year investment. The question is, how do we make sure that at this particular moment in time where revenue is declining, the state is going to be looking to make cuts, that we continue to take the data that are available and really, really surface the important investments that are needed around 0 to 5. And at least my assessment of the landscape at this point is that the 0 to 5 conversation is not what it should be, and that a lot of the data that people are talking about is at least 5, 6, 7 years down the road. And so that, I think when we say connector, it's trying to kind of connect the work that we've been doing historically to these new efforts, but also saying we don't have to wait. Let's kind of use the data now to make sure that we're being really strategic when it comes to 0 to 5.
And when you say use the data now to tell us what, where we.
Sure, I can give a very concrete example. So we've been doing the record reconciliation, which people are like, what is that? That's the big linkage that we've been carrying out with CalHHS through philanthropic support. The reason that we have been doing that linkage versus HHS is because as a third-party research entity, the departments were able to enter into an agreement to share data with us, but didn't have at that time the internal capacity to combine all that data. We're now at the stage where we're trying to hand that effort back to HHS. They've set up CDII, which is the Center for Data Insights and Innovation. But they've just had to ask us to do another year of the linkages because they're not there yet. And so we're like, okay, great. If we're going to do another year of the linkages, why don't we also set up some different products that can be pulled out of those linkages that are about 0 to 5 populations? Because right now, if you go to the open data portal for CalHHS, what you will see is you'll see all sorts of information on cross-program participation. You will not see anything that would allow the commission to drill down to a 0 to 5 population. So that's a perfect example where the data exists, but no one else is in a position to present that 0 to 5 population, even though some of that information may be critically important to investments that the commission makes, that other big agencies are making, and that counties are making.
So just to refine it a little bit, you're saying if there's somebody who's participating in CHVP, California Home Visiting Program, they're also potentially receiving another type of public funding, you'd be able to say if they have a baby. I'm trying to break it down like
no,
like,
it's perfect. I'm like, I
need a
wish we
specific
had
example that you could say with
so
us, we'll be able to do that.
Okay, perfect. So we have data that would allow us to say, here is a family that was receiving WIC benefits. And here's how many were also receiving CalFresh benefits. And here's how many weren't. And here are the geographic or racial disparities. Mm-hmm. And we're already helping the state produce some of that data at a very, very high level. What we're talking about doing is drilling down. So a lot of that cross-program information is also made available for 0 to 5 populations, which currently it is not right now. We just have children 0 to 18. So that's one area.
5. So I don't know if WIC's the best example because WIC's just 0 to 5.
Fair enough. How about CalWORKS and Medicaid or developmental services? So those are, so again, I think of the big systems and how 0 to 18 is great, but 0 to 5 would be something we don't have right now. And that the state will eventually be able to produce, but we're proposing, let's not wait a few years for that. Let's make sure that we're generating that now because important decisions are being made.
And can I add, this is part of that catalytic investment, if you will. It will get there. And I think I've heard time and time again, even yesterday, is that 0 to 5 is delayed and sometimes feels like an afterthought. This is our opportunity to invest so that we are primed and ready to be integrated into those bigger conversations. I was part of the design team for Cradle to Career, and all due respect, they were focused on the older kids, and we were missing the boat. But I'm grateful that both Reagan and Emily are part of the conversations on Cradle to Career, and I affirm that the 0 to 5 is a little bit couple years out.
Well, but Cradle to Career, just as a point of clarification, is because they said it delineated. They're starting first with higher ed, then they're going to connect it to the K-12, then to employment, and then I think ECE is maybe the third line. So it's, and what I heard as when my previous hat, when I was part of those discussions, is because we didn't have the ECE data because it's so like amorphous and it's hard to get programs to get that specific. So I'm a little like, I don't know if that, I just want to be mindful. I do have a lot of questions, I think, about the what, because you're trying to do a lot of things. And I'm like, maybe if you could hone in on one particular one versus those 4 buckets, it seemed like a lot. And finally, if First 5 LA was paying for this, why can't they keep paying for it? So that's a fair question too. I was like, okay,
So that's a very fair question. First 5 LA was not sponsoring a lot of the state level work. So First 5 LA was asking us to generate some LA specific statistics that would help to inform their strategies. And so this would be the first time that we would be kind of trying to move, since we've always been working with state level data, to thinking about some of those state level metrics as opposed to just LA specific data.
got it. Is there a way to show us what you did for LA to say we can now do this for state California versus, what we have now? That might be helpful. I need to see and understand more.
Absolutely. Reagan, what I'm thinking that might be helpful for the commissioners to see would be some of the prevention and other system indicator metrics that we've been generating for First 5 LA for their internal use. And we can certainly share that.
Thank you. Any other comments from the commission? Public comment?
We don't have any hands raised yet.
Thank you. Okay, so this is an information item. Thank you for listening to all my questions. I am just very interested in what you're up to and just would like to explore a little bit more. You'd also mentioned, Jackie, perhaps at the program and evaluation subcommittee could also dig into this as well.
Provide additional data. While we have them, are there specific Chair Perez or others that you would be helpful to unpack at that advisory level? I know that you put out a couple of questions, and I know that Emily and Reagan took some notes, but just one last opportunity to raise up any clarifying questions for us to come back to the
Could you
advisory.
go back to the four buckets of your proposal, please?
Oh, sure. Hang on one second.
And this, Chair Perez, one thing I'd like to add to in clarification of this connecting role, one thing that we have also noticed is with all of the various data initiatives that are in flight, it's been difficult at times to identify what data they're talking about, right? We say the word data, but data can exist in many forms, right? And so one of the things that we are hoping to bring to this conversation would be a focus on individual level data and the specific potential for data systems to be able to link in and have integrated level data so that we would then be able to look prospectively for children across time, and that these kind of data systems would be interoperable rather than kind of moving on separate tracks, which would be difficult to kind of roll back once the trains have left the station.
Got it. Thank you. I think it would be helpful, yeah, for any, just within the subcommittee to go a little further into these proposals. So for me, the fact that you do want to engage with families and authentic voice, that is important. But I am mindful that, for example, local First Fives do that. Actual CBOs already connected. I just always get nervous when I'm not, no prejudice to you all, researchers come in. We want to talk to real families. We want a focus group. It just makes me nervous. Like, I don't know if that's perhaps another entity, you partner with another entity who already is connected, who that sort of, connection versus folks coming in and doing that. I hope you can understand what I'm trying to.
I completely understand. And I fear that we may have tried to pack too much into this information presentation, because The reality is when we were talking about focus groups, we always imagined those being very, very local through county partners. I think the one place where we can add value when it comes to family voice, and I think this is really, really important, is thinking about a population-based effort where we know, based on the Strong Start Index, that we are reaching families specifically who have not only just given birth, but also have characteristics that make them the ideal candidates for, say, our home visiting programs. And so understanding directly from those families, not through focus groups, but through a more systematic quantitative effort to collect data as to whether they are even aware of those services in their community, whether they were ever approached, whether they are engaging, and if they drop out, why. I honestly can't think of any comparable data that would be available. And we can think of it both as kind of family voice, but I also think we can think of it as consumer satisfaction. So often we create these big publicly funded programs, and we rarely ask people how they're experiencing the services that we think they should want. And so this is really an effort to do a very focused effort with exactly the families who tend to have lower engagement rates. And maybe it's because we haven't really systematically gathered some of the considerations that factor into when they do or don't say yes to, for example, a home visiting program.
That's a great example. I would love to hear at some point, maybe at the public subcommittee or the program and evaluation, how local First Five, since they at the beginning kicked off a lot of homegrown home visiting programs, how they've been collecting that information with their families about what happened when if you dropped off, or getting a better sense of that. So I guess what I'm trying to say is just going back to what First Fives have already been doing, what lessons they've learned, and hearing from them how this proposal is absolutely, we think all of these would be helpful to our work, as well as potentially any other stakeholders. I get nervous when we always say, after we get awarded the contract, we're going to talk to stakeholders. I heard from CYBHI, from DHCS, before they put out an RFA, they talked to hundreds and hundreds of stakeholders before they even crafted it. And to me, that's a much more inclusive way to hear before we start awarding money. And that's not anything related to this particular proposal, but I'm just moved by how other entities in the state are engaging with stakeholders, not after the fact that money is awarded, but before, to see, does this make sense? Do you think this will help? Okay, with that, thank you again. I appreciate, and I look forward to hearing when you're there, so I can go and learn some more. Thank you. Okay, Jackie, do you want to have any?
No, this again, I think a lot of really great feedback. We will direction here, from my understanding, is to go back to the newly formed program and evaluation advisory and talk, we will touch bases with advisory chair majors about the next steps on those meetings, because it seems like a sooner conversation is better than later. And I'll turn it back to you because I believe we have one public comment from Avo.
Oh, great. Thank you, Avo.
Hi again, commissioners. I know I'm standing between you and adjournment, so I'll make this quick. I just want to emphasize the comments made by commissioners on this CDN work, and just want to say that I think we have a great opportunity of looking at population level data that we don't have today. It really is connected to the 25-year look back as well, and we are ready for some more conversations at the committee level for sure. All that said, I want to just emphasize our partnership for many years with the Children's Data Network. They've been a staunch partner of ours, especially through the Strong Start Index and that creation, and just look forward to working with them and the First Five Commission on this. Thank you.
Thank you, Avo. Thank you, Children's Data Network. I really appreciate you taking the time and sharing all of your knowledge with us. Okay, with that, looking again if there's any hands up. Okay, with that, I would like to call, is there a motion to adjourn?
I'll move.
Second.
So moved by Commissioner Jimenez, seconded by Commissioner Majors. I don't need to announce it, but I do want to say June 15th will be our next commission meeting, and we are adjourned. Thank you very much.
Thank you.
Bye.